you cool cats and kittens. This is Elizabeth Johnson Phillips, and I am here today. We are going to talk about human resource policies and technology and how they can help us in light of COVID-19. I am the content developer for MPWRSource, and I am here with Tommie Deaner, who is a human resources whiz. And I'm also here with Dennis Cow of Proactive Information Management, and I'm going to give each of them some time at the top of the hour to tell a little bit about themselves and what expertise they bring to the table. And then we are going to get to the questions. I have gotten some questions from people about what they need to do in terms of human resource policies, in terms of telework, and we're going to just dig right into those questions. So Tommie, you're up first. Tell us a little bit about yourself.
Great. I'm Tommie Deaner, and as Elizabeth kindly referenced, I'm an HR whiz, but I don't know, I would call myself that, but I've been in human resources for over 20 years, working in a lot of various industries. My skills and expertise really lie with help.
Oh, you got stuck. You got stuck. Hold on, Tommie. Hold on, Tommie.
What did you do?
I did nothing, but you were like this for like 30 seconds.
Oh, you're going to have to re-record.
No, it's just how it is. You know, you were thinking of something very deep and profound. So you have been in human resources for 20 years. Go.
I've been in human resources for over 20 years, and my expertise and skills lie in helping businesses optimize their workforce and providing support to employees to make your business more effective.
Awesome. And Dennis,
I'm Dennis.
Tell us a little bit about yourself.
I'm Dennis Cow with Proactive Information Management, and like Tommie, I've been in the IT business for 20 years. Echoing her sentiment that, while she's doing the people side, we do the technology side to help people become more efficient in the workplace through technology.
Yes, I think there's some quote that technology is at its best when it's invisible.
That's correct.
Yeah, so that's, when it is a tool that helps people. And so this blend of human resources and technology, particularly in light of people teleworking and us trying to reduce the spread of infection, the two blend well together. And so I am going to talking about coronavirus and in terms of, okay, my window is open and there is construction outside. So just hold on. This is embarrassing, but there we go. That should probably help. Okay. Should probably edit that out. Anyways, so in terms of in an office space, in a business, whether you're a healthcare practice or even Dennis in your work, each of your employees is probably responding to coronavirus a little bit differently. You may have employees who are in full-on hazmat suits going to the grocery store. You may have employees who are throwing bonfires and parties. Everyone's on a different, scale. Let's say your partiers, like a scale of 1 to 10. 1 is that red-faced, spring breaker that we all saw in Florida, and 10 is they are creating forts out of toilet paper and wearing a hazmat suit. Most people that I talk to are not 1s or 10s. Thank you. That's good for all of us here. But what to do in an office if your administrative staff, your bosses, are 5. Let's say 5 is sort of your norm. And what to do if your employees are not at the same space? How do you best tackle that?
Yeah, so I think that there's a lot of things to consider as businesses start to reopen, obviously starting with employee concerns and fear about being reintroduced into the workspace. And I think that we as employers need to remember that those fears are probably based in truth because we're still in the middle of the COVID-19 flattening the curve process. And so really as employers, we need to be thinking about what are the things that I can put into place to help alleviate my employees' concerns related to things like workplace safety, my benefits, What types of policies do I need to put into place in response to reopening my business while I'm still in the middle of this pandemic? So there's a lot of things that you can do as an employer to structure those to help assure your employees that you're doing everything you can to keep them safe when they come back into the workplace. It really comes down to clear communications and making sure that you articulate what the plan is and how you're going to make it a safe workplace when they come back.
And Dennis, how can technology help alleviate some of those fears?
Yeah, so I think with the introduction of all these tools that we have today, like Zoom and Microsoft Teams and products like that, we can certainly help mitigate having employees coming in who's fearful of certain work environment, right? So echoing what Tommie has said, we can't really force anybody to come back to work. I wouldn't recommend that. But I think that we can use technology to bridge the gap and the communication gap so that we can still feel like we're there as much as we can. Certainly due to video conferencing and webinar sessions like these, it really does bring people together a lot better, right? So I think technology plays a big part from now, and I think everybody adapted pretty quickly. And I just see that the growth is going to be pretty big in this space of being able to work remotely and still being collaborative and also be safe. And that's the key, right, to hold this, right? And try to be kind of to the middle ground with everybody, not just from the employer perspective, but also the employee perspective. And I think that's also important because we certainly don't want to force employees to come to work or go out to somewhere they're not comfortable at. And I know a lot of them will probably do it because you asked them to, but they also have children at home and also elderly parents at home that they might go visit or go to, which they could actually bring that to them, even if they're asymptomatic of the virus. So I think technology can bring a lot of that gap, especially with FaceTime and all the technology we have through various devices. It certainly can help, mitigate some of those concerns, if you will.
Yeah, I remember seeing at the very beginning of all this that meme that said, "Well, I guess we're about to find out which of those meetings could have actually been emails." And I guess we have that. That's a way. And but you had just highlighted something that an employee, it's not when we say we're going back to normal. It's a new normal. It's not. Our kids are out of school, so there is going to be an additional childcare piece that comes into this. So what would you say to the employer as to how best to meet those needs? Maybe it's a doctor's office and they can't let all their staff work from home. Certainly there are roles within a healthcare office that can telework. But if I'm having to be a nurse and physically assess people, and not everything can be done through telemedicine, so many things can, but not everything. But I have employees that don't want to come back. How would you handle that situation? So obviously it's delicate.
So I think, it's a real struggle because especially in the medical practice space, there's like as you said, EJ, that people have to be there. We need our medical assistants in the office to, help room our patients. Our physicians have to be in the offices to see the patients. And so, you can't say that everybody can work from home. So I think the first thing I would evaluate is really kind of understanding what your recall procedures are for your staff. Who needs to come back? Why do they need to come back? And which jobs can continue to be done remotely? Because I think we're going to see that we're going to continue to need people to still work from home because of social distancing and wanting to limit the number of people that are being exposed in the workplace. So making sure that you establish clear recall procedures for which team members you want to have come back in. Once they're there, it's going to be super important to have good safety protocols, right? Are you doing screening before people come into your medical clinics to make sure that, they don't have temperatures, they haven't been displaying symptoms? And that would apply both to your patients as well as your staff. And then do you have the appropriate PPE for those employees? Should your front desk staff be wearing cloth masks or disposable masks? What are your procedures about meeting spaces and break rooms? Are they allowed to use it? So making sure that you put those appropriate guidelines in place. Your second question is about the person who can't come back to work because they don't have childcare, and that's a different issue. And depending on the size of your practice, you might fall under the Families First Corona Relief Act, and those changes were enacted to cover and provide some protection for employees who can't come into work due to childcare. So my recommendation is know where your employees are and who can come back into work, who might have some restrictions, and really try to work with them to figure out the best approach, because it's a real issue. And you don't want to lose your good employees at the expense of this situation. And so really trying to be flexible and kind of making sure that you understand where your employees are and who has restrictions, and can you accommodate that.
So which employees do you suggest, just as sort of the whole economy is reopening in some places differently and at different paces, and even here in Virginia, Governor Northam has just today, dental offices and healthcare providers can start seeing non-emergent cases. Still no word on haircuts.
I know, I gotta get my hair dyed.
When I heard that, I was like, I don't care about going to see the doctor. I need to see Brandon in a head of hair. But but it's coming out piecemeal. It's coming out slowly, which honestly I think is appropriate. So is there a way to implement that in a workplace? Is that a suggestion you have?
In terms of implement?
Like not bringing about speaking to your staff. I mean, I'm literally just making this up, but speaking to your staff in such a way to say, hey, team, let's make the numbers round. You have a staff of 10. So, hey, there's 10 of us here. We want to stay under 10. So I'm going to have this staff come back first, or this staff work Monday through Tuesday, and this staff work Wednesday and Thursday, and this staff work on Friday. Do you recommend playing with your schedules like that?
Yeah, I mean, I think that medical practices and businesses in general are still going to have to look at their staffing levels to figure out what the business requires. Just because Governor Northam said we can start seeing non-urgent cases doesn't mean that principles related to social distancing and patient volumes get lifted immediately, because you still have to make sure that we're practicing good guidelines so that we don't spread the virus. So you still may not be up to 100% patient volume in your clinic, so you may not need as many employees. So again, kind of really looking at what are the business needs, which positions do I really need to have come in to work, which ones can continue to be worked at home, pieces and parts of jobs too, right? So a medical assistant might also do scheduling, and maybe the scheduling component can still be done at home. And then when they need to do clinic work, they come into the clinic. So it really depends on the operation, the needs of the business, and I think just really kind of evaluating that and making those decisions and those schedules based on what the business is going to need. Ultimately, switching your staff in and out might make sense. It might make sense to recall a team A and have team B still working from home. So you've got to look at what you require for your clinic and for your medical practice.
Now, obviously, that's going to take a lot of communication. Dennis, now, would you recommend, as you doing all those communications, still having holding as many of those meetings virtually as possible?
Yeah, I think it's what Tommie said. As leaders of our companies, the safety and well-being of our staff is certainly the number one priority. And secondary to that, if you have visitors coming in, like a lot of our clients, it's medical practices, the safety of the patients is also a grave concern too, right? So, I would almost categorize it to what's considered essential and non-essential employees of what needs to be there. So, there's a lot of things technology can do for offices where they do have visitors coming in that, especially with voice over IP or technology like this, where we could set up a phone from home, or a lot of them have apps that you can do on cell phones now, and allow them to work from home. Certainly, if you have a server environment or your software is in the cloud, You can do a lot of scanning from home. There's a lot of administrative tasks that you can still do from home to limit the amount of people that is in the office to help, with the whole social distancing aspect, right? So some of the practices we go to, like dental practices and stuff like that, even if they try to be 6 feet apart, they just don't have the room to be 6 feet apart. I mean, that's just the truth. So it's how do you kind of use technology to help you come up with creative solutions that will allow you to function as a team, but also allow you to keep the order of, the social distancing order so that you can help flatten the curve, I guess, if that term is still being used today. So it seems like that term was used like 2 weeks ago, right? I mean, it's like that was a new term 2 weeks ago, and 2 weeks later it's not a new term anymore.
Stop the spread. Stop the spread now.
Stop the spread. So you really need to evaluate.
Now just back the heck up, people.
Yeah. So you really need to evaluate like what is considered essential that really have to be there, because today the technology can really help out a lot. Of course, it brings a whole bag of issues of, can that employee function appropriately at home? Are they a type of employee or a type of person where they're self-motivated and get up and do their work and do whatever it is that they need to do to accomplish the task? But I think this is going to be a new normal going in, right? You're going to see that there's going to be a lot more leveraging of technology to accomplish all these type of work, and then to adhere to the social distancing aspect of this whole COVID-19, going forward. And I don't see it change in the next 12 to 18 months. If anything, I think it's going to accelerate the pace, because now people are finding out I could work at home. And there are also people who find out that they cannot work at home. Like,
there's also some of us that really enjoy wearing pajama pants as we work.
Yeah. Well, it's not that.
Can we bring those into the workplace? That's the next question. Can we have PJ days? Like in kindergarten?
Well, I mean, I think, and you, Tommie, you can probably touch a little bit on this, because she's more on the people side, and I'm obviously more on the policy side. I'm more on the implementation side of things. But I struggle with just going from meeting to meeting to meeting, right? I don't have that mental break I need sometime, and then all the meetings just run together for me. So there's also, those issues that comes up with working, and that old saying, you can be active, but doesn't mean that you're productive. And I think sometimes that does become a real issue with this whole working from home thing, because I'm just going from meeting to meeting and meeting. I don't have time to decompress, write down my notes, do whatever it is, because I don't have that travel time that's required, where I can just be in a car and hit record really quick and record some notes I need. So come back and remember it later, because I'm hopping from one meeting to the next meeting,
I think that's an important point, Dennis, because this whole epidemic, or however we want to categorize it, COVID-19, has really created a lot of challenges for people's mental well-being and mental health. And so as employers, if we have resources through our benefit plans, through employee assistance programs, again, it gets back to kind of understanding where your employees are and making sure that we're helping them in ways that will benefit long-term loyalty to the corporation too, so making sure that, if people are feeling stressed out or they have financial concerns, many employee assistance programs have resources available to our employees. And a lot of benefit plans have those types of resources too. So making sure that you understand what you can give to your employees is super helpful as well, because it is a really stressful time. And as they come back into the office, it's going to introduce a new level of stress for them in terms of potential exposure. And so again, anything that we can do to support our employees, I think, is really key.
Yeah, I mean, I can even attest that there's been, working in marketing and particularly the PR piece of my job in the midst of a crisis has been very frenetic. I've been going along, and then bam, something happens and I have to quickly change gears. And so it has been a gift to me to sometimes I'll be working, and then all of a sudden a message will pop up from my boss, and it will say, "It is 11 p.m. Back away from your computer." I'm like, but I'm not done. And she'll just say, I don't care. It will keep till tomorrow. Go to bed or go be with your kid. Live your, take a break. And like you said, you have those spaces when you're driving from one meeting to the next, or a doctor's going from a patient to writing the notes, sitting in their office to seeing the next person, where if it's all telehealth, it's back to back to back to back to back, and things do blend. So I think it's really wise for employers to, weave into their day, to the schedule, those break times. I think that's going to be actually a blessing of all of this, is we're going to be forced to be patient. And that's going to be hard for everybody, but I would be remiss if I did not mention something that's been rammed down my throat from our compliance person, is for all employers and employees to remember that you need to build into your schedule cleaning and disinfecting. That may have just been an end of the day thing for you. If you're a healthcare practice, it's obviously between patients, all those clinical areas, but it also needs to be at the front desk. So that's going to be another step that your front desk people, that's going to be another job that you're giving people that they're not normally used to having to do that.
Yeah.
How do you think that's going to go down?
I think people will be on board with it. My experience has been that I think people are very sensitive to the situation and what they need to do. Kind of tying back to your last question about virtual meetings and communication, I think before you start bringing your employees back into the workplace, it is really critical to have a meeting to talk about, these are our workplace safety protocols. These are our social distancing protocols. This is our policy related to don't work sick, right? And Angela says that all the time. So as a medical practice, making sure that we're reinforcing that, we're setting clear expectations with our team members before they even come back into the office is super important. And then having regular huddles with your staff to remind them of what your expectations are. And again, it gets back to helping employees feel comfortable that we're doing what we need to do to keep them safe when they come to work.
So we want them to leave at the end of the day the same way they came.
Yeah.
If not better. You talk about as people return to work, and obviously this is one of those conversations you would have with your employees. What physical modifications may an employer need to make to their workspace?
Yeah. So, obviously, you probably need to, make sure that you're paying attention to your lobby spaces, making sure that there's social distancing if you're letting patients come into your lobbies. Are you doing screening? Where are you doing that screening? If you're doing temperature checks prior to people coming into the practice, where's that happening? Do you really need your two front desk people sitting side by side? Can they be apart by 6 feet? When you're having face-to-face meetings, do you have enough space in your conference rooms to have those meetings? Are you going to require masks? So, there's a lot of things that a practice has to think through in terms of the physical space before employees return. Do I need that person to actually come back to work, or can I keep them teleworking? That's going to be another question that you have to address.
So but here's some questions. If I'm an employer, can I require my staff to have a daily physical screening before they come into work? Can I take their temperature? Can I legally do that?
Yes, you can. And my recommendation is you probably need to screen them whenever they come into the building, as well as your patients. And then I know that some practices have implemented kind of like stickering protocols. So if your staff member has already had their temperature taken that day, they just get a sticker for that day. So there's different approaches that you can take, but absolutely you should be taking temperatures or doing some sort of screening before people come into your clinics.
And that actually, I have not heard the sticker thing, but actually I would think if I were going to the doctor and I saw the nurse that said, I passed my temperature check, it would make me as a patient feel calm. It would make me feel good. Like if I went into a doctor's office and the front staff didn't have masks, because I don't, OSHA, they're not required by OSHA or whatever to have, but if I didn't see them with masks on, it would probably make me more anxious. Like, well, this is a doctor's office, and there,
yeah. I mean, that's a great point, though. I mean, right? Like, as a physician practice, you probably need to be setting the standard a little more than the general public, right? So it's not like going into the grocery store where it's like everybody's touching the carts, and you probably
Taking their
need
gloves
to
off with their
be
teeth. I'm like,
modeling. Yeah, so so you're like, so I mean, and that's a challenge, because I mean, I think that, in the healthcare space we get so complacent about being in the clinic, and it's probably the one time where we probably need to be showing leadership and demonstrating the way in terms of good practices related to the virus. So,
and have that hand sanitizer right there, which in a doctor's office, that's usually actually right there. You have the pins in the flower bowl that they've made into flowers.
Yeah.
I think that's standard, right? And then they have the hand sanitizer.
But that's a good point, though. The flower pins, you may not want to have those out there. A lot of
BYOP, bring your own pin.
Yeah. So, I mean, those are the little things from a workplace safety perspective that you have to think about for your front desk staff, because you don't want them touching it. Or if they do, are you wiping them down in between every patient? I know it sounds really crazy, but, touching credit cards, those are all things that need to be thought about as you're reintroducing your staff to the workplace. So.
Mm-hmm. Yeah. So what do I do? I'm an employer and I am requiring all my staff to have PPE. I've provided it. What do I do if I have an employee that reports to work without it?
I think that becomes an expectation and performance issue. I would send them home. Or if you have something available for them to wear, give them something to wear. It's a requirement for them. If you've set that and established that as an expectation and requirement for your clinic, they need to abide by that.
Okay.
So.
And can an employee require health testing?
An employer?
Mm-hmm. Say, hey, if you guys are working in my facility, I want to make sure you have a clean bill of health.
Yeah, I think that's going to be, so sending your healthcare providers to have COVID-19 tests. Is that what you're asking? Like, to make sure they're not positive? I think it depends on the situation. Are they exhibiting any kind of symptoms? Have they?
Even an employee, you mentioned we can take the temperature, but there may even be employees who are like, no, dog, I don't take my temperature. I mean, I can't imagine that in a healthcare.
Yeah. If they're not willing to have their temperature checked, and that's part of your screening procedures, I think then they have to be turned away, just like your patients would be, because again, it's part of your workplace safety requirements.
So we talked a little bit about this, but if and when a COVID-19 vaccine becomes available, can an employer require vaccination?
That's a tough one. I don't know where we're going to land with that. Right now, requiring of vaccinations is kind of a slippery slope, because there's a lot of people who, don't believe in it in terms of religious beliefs or, other personal beliefs. So it's going to be interesting to see where the legislation lands on COVID-19 vaccinations. But right now, I think it'll be difficult if it's not an essential test that we would be able to require that. But a lot of healthcare providers have to get their flu shot to have hospital privileges, different things like that. So I think it's really going to depend on the role and the job.
Yeah. Speaking of different roles and different jobs, let's say I have an employee that has a risk factor. Maybe they have asthma. Maybe they are pregnant. Maybe they are overweight, or one of the million other things that we don't even know yet that is puts them in a risk group. Or maybe they're old. I'm talking about you, Dennis, now. No, I'm just kidding.
Yeah.
Now, are there certain accommodations as an employer I need to make for them? Does this play into the Americans with Disabilities Act at all? I mean, does this come into play? How do I cover myself as an employer?
Yeah, so there's actually, so ADA probably doesn't play into this right now because, obviously being exposed to COVID-19 isn't a disability as described under the ADA. But there's other regulations that may be at play. So the Families First Corona Relief Act came out with certain provisions related to requiring people to pay small businesses under 50, some medical care practice exemptions in this. So you got to read through all of this. But requiring paid sick leave for somebody who's been exposed or has to care for somebody who's been exposed to COVID-19, allowing people to have time off for school-related closures. Again, I believe there's a medical practice exemption to that. So, make yourself familiar with the FFCRA. So you can see the requirements in that for small businesses. For larger employers, Family and Medical Leave Act might play into the situation if somebody themselves is sick. Because of COVID-19, that might be a genuine leave event under Family and Medical Leave. This is for employers with greater than 50 employees, as well as if they have to be a caretaker for somebody who's sick with COVID-19. So I think it's important to kind of understand the context of what's happening with the employees so that you can understand which regulations they would fall under.
Okay, because I mean, it may not, obviously you may have employees that you've already made accommodations for that are going to stay in place, and they do their job great, but they need something. So okay, here's one. How much information can an employer request from an employee who calls in sick?
Yeah. So that's a
although I dare say people aren't going to be calling in sick for, to just chill out at home for a while.
Yeah,
it's hung out at home enough.
Yeah, it's a slippery slope because it's still, protected health information that you're asking of your employees. So I think you need to know enough about the nature of the illness. And obviously, if you've got screening guidelines coming back in, then you can ask those questions as appropriate. So I think you need to know enough to figure out what rules and regs apply to that particular absence.
And may employees require, I mean, this is a hard one in terms of, it's spring.
Yeah.
I can go ahead and tell you there's many times, like a lot of people, my throat will get scratchy.
Yeah.
And I'll get them like, do I have it? And I'm like, no, I mowed the lawn yesterday and I want to rip my eyeballs out. This is this is not a respiratory infection. Mm-hmm. I need Benadryl. But how can employers determine, like in that screening process, can they just say, are you experiencing your respiratory systems? Mm-hmm. How's your sense of smell these days? Those sorts of things. Yeah. Can they ask those pointed questions?
Mm-hmm. So under the CDC guidelines, there are certain things, certain symptoms that people would demonstrate if they're positive with COVID-19. And so we actually on the MPWRSource website have a sample screening guideline that kind of shows how you might structure those questions. And you definitely would want to rely on sort of the CDC guidance in terms of, what those symptoms look like. Respiratory issues, have you traveled anywhere, temperature in the last several days. So, there's just there's a sample out there that you can ask. And I would just recommend following CDC guidelines on that. The good thing with medical practices, since this is about medical practices reopening, if you have somebody who's got that scratchy cough from allergies, hopefully you have a provider who can weigh in on that and make a determination if that's the only symptom that the person is experiencing is that scratchy throat and they're known to have allergies. If you have any questions, I would recommend pulling in a provider to help make that determination as to whether or not people are okay to come back.
That makes sense. And I know you mentioned the sample screening guideline on the website. I will make sure, and At the end of this, I always upload the entire video to YouTube and email it out to all interested parties. And I will make sure in that follow-up email, I include a link to that screening guideline that you had. And I know that there is out there, there is let me see if I can pull it up. I may actually have it on my computer. Oh, I do. It is the MMWR. Do you know this? Work restriction that basically says for this illness, you need to stay out this number of days. For this illness, then you need to stay out this number of days. And it's there in black and white. And I think sometimes it can be helpful if you can point to something.
Yeah, that's great. So you'll have that out there on the site?
Yeah, I don't have it on the site. I am now going to get it on the site, but I can also include it as the link.
Look at us using technology, Dennis.
Yes.
Shocking. Surprise.
Be thankful you're there and I'm here. You mentioned earlier at the beginning sort of the sort of elephant in the room that is as much of a health risk as, at least in my opinion, a health risk to the population as the respiratory illness, actually COVID-19, and that's the mental health effects. Mm-hmm. And that's true whether you work in a healthcare practice or whether you're a stay-at-home mom or whether you are a business owner or you work in a grocery store. Walking around seeing people in masks is not our norm. Yeah. It is in other parts of the world, but it's not here. How can employers, I guess, alleviate some of that anxiety for their employees? And is that sometimes just going to be, pretending? I mean, because I imagine, I'm not an employer, but I imagine that sometimes employers get anxious, and because you're human, and sometimes you're just making it up as you go along. So, but I think you've used the word leader a lot. What can the leaders in our businesses do to help alleviate that anxiety?
Yeah, so I'm going to ask my Iron Man over here, what are some of the things that you found were effective with your workforce through this crisis?
In terms of what, mental health?
Yeah, and just helping to kind of alleviate the anxiety of your workforce.
We say you work out every day.
Yes. Wellness. You can focus on wellness. That's a huge component.
Yeah, you do.
Will you buy me a Peloton?
You can come to my house. I think keeping a regular schedule is probably very important. The daily routine. I was actually talking to a friend of mine who is actually in some behavioral health, and he actually owns a business too. But he was a behavioral health doctor before this, and he said keeping a normal routine is a really important item because we all have this routine that we wake up in the morning that we were used to, whether it's taking the kids to school at a certain time, you got to get up by a certain time to do certain things, or have that cup of coffee in the morning while you're driving to work or whatever. Come up with routines so that your day doesn't run together. And so you can be more effective. I guess that would be something really important. So I tend to get up in the morning and try to keep my routine, although it's been really difficult because, as they say, when you have your own home gym, you probably go to the gym less than you do because you drove there and you have to go and stuff like that. And then, of course, there's that social aspect of when you do go to a gym, for example, or you go out for a run or you go certain things, you have that cohesiveness of other people with you, right? And now you're doing it by yourself. So if you're not mentally strong or you're not something that is used to an endurance sport or any type of sport that you're by yourself, then it becomes really difficult to motivate yourself to get up and do these things for yourself, right? So, and I was talking to, I think it was Tommie or Jonathan yesterday, and I said, it would have been nice if we could just all got out and went and had a beer. And sometime, even though you have this meeting, just by the setting of going out to have a beer somewhere or just somewhere social in a restaurant, have a cup of wine or whatever, or a glass of wine or something like that.
That's what we're drinking out of now these days.
Yeah, that's true. That's true. You kind of get a little bit of social, a different social aspects of doing things, right? So I still think it's really important to keep a routine. And you could go out and work out and do two, right? No more than two on a side. I mean, I go out to run a lot, and I see people running, and if you're on the same side of the road, they will be running on the other side of the road just so that they're away from you and stuff like that. So there's stuff that could be done if you choose to.
Yeah.
I still go out and ride bikes. It's kind of hard to be kind of easy to be 60 feet apart when you're riding a bike with 3 or 4 people. So for all the things that you can do. So anyway, so I do try to keep a certain routine. Get up, get your cup of coffee, make your cup of coffee. Get your kids out of bed like normal and get into a routine.
I will say I'm glad we are keeping a routine here at my house, but we are not keeping the 5:45 bus stop routine. We have thrown that one out the window. We are enjoying a more relaxed routine, an 8 a.m. start versus a 6 a.m. start.
Yeah. So I think to kind of capitalize on a couple of things that Dennis said, as employers, we can focus on helping our employees focus on wellness. So if you can provide programs or opportunities where they can be well. I know that here in the Richmond area, Sports Backers is doing the virtual 10K and the spring challenge, trying to keep people engaged. So if there's things like that you can do as an employer to help get your employees not stuck in the room, in the office that they're in all day, if they're teleworking, continuing that open communication, making sure that they hear from you and they stay connected to you. We do a ton of Zoom calls, this team here, and just seeing people's faces versus just voices over the phone really has helped me tremendously in terms of my anxiety and mental health. So I think there's just a lot of things that you can do as an employer to keep those open lines of communication to help stay connected with your team. So for sure.
I think it depends how much you want to participate in it. I know a couple practices where they have a really big waiting room area.
Mm-hmm.
And they, of course, every waiting room has TV. So they have some, employee gets together after work, since they're there all day anyways. It's not like,
Mm-hmm.
they've been in and out and haven't been tested, and they do some sort of, workout videos or something, and kind of everybody get together and work out.
6 feet apart though, right?
6 feet apart, with the yoga mats and all that stuff, right? So, there's things that you can do creatively. It's really hard to be 6 feet apart. I can tell you that. I mean, because you just don't think about it, right? I mean, especially when you're in medical practice in the nursing station area, which I've been to recently. They're going from one computer to the next computer, and we all know the phones and keyboards are probably the nastiest thing in the world, handsets, and so they're already kind of exposed together. So, I think if you are in a contained environment and you're already there, and you can still, obviously you can't make it and force them to do it. Yeah. But if you can say, hey, this is something we would like to do. If you want to participate, it's on your free will. If you want to participate, if you don't want to participate, that's totally cool. And you can do some employee engagement programs to help them feel like the team still exists, right? Because I think that's the toughest part about this whole social distancing and stay-at-home order. Is not necessarily the technology, or the technology is not there. It's the social isolation that's the problem.
Yeah, it is hard. I know, Dennis, you didn't mention it, but maybe it's because I think we invited you. Our team, larger team, we had a team's happy hour.
Yeah.
Yeah, we did. Yeah, I was there.
Yeah, and Kyle led us through some game, some murder. Was it a murder mystery? I don't think anybody died.
It was a mystery, like a clue or something, wasn't it?
But it was like a trivia game or something, and it was super fun. And I've done with another group I'm in where we had a competition to see who could have the funniest background.
Mm-hmm.
Different, I think those team building aspects that you've mentioned, whether it's through physical activity or just a shared interest that you have, are going to be great in terms of getting people back, because that is a reality to this pandemic as well, is that everybody has seen these gaping holes, because some people may have already felt isolated even when they were going and coming. Mm-hmm. And some people are like me and extroverts and need people, and are now like, totally alone. So you're going to have to, and I would think as a doctor, you're going to have to realize that your patients are in the same boat. So when you go to schedule appointments, maybe tack on some talkie time. For your
Well, I can tell
patients.
you, if it wasn't for this social isolation, I pretty much won't be doing this webinar with you right now at 12 o'clock because usually Friday afternoon I'm gone.
And we
5
know
o'clock
where you are.
on a Friday afternoon.
Yeah.
Right.
Well,
I think I think that's the thing, right? It's not so much. Even I don't think video conferencing call can replace the social isolation. And
Yeah.
there's a lot of people out there that's already depressed and have anxiety over all this stuff. And I think that social isolation just compounds the problem even more. So I'm with Tommie. I think if you can find a small group, as long as as long as it's 2 people or 4 people that's apart and you can trust, are these for people in your neighborhood or people that you just know all the time next door, just be smart about it. Go out, don't get a crowd of 50 people together, but be smart, go out and live as normal as you can. I think that's important, right? Because this is obviously going to be the new normal for us for the next 12 to 18 months. It's not going to be anything different.
Yeah.
I think even if they find a cure or whatever it is, I think it's still going to be in our mindset, right? Because there's still going to be people out there who think this is all, this is untrue, this is all government made up, and there's the other side of it where people are just so afraid that they don't even want to live their home, leave their house, right? So there's that extreme.
I do think it's important and good that we've all now learned how to wash our hands. I mean, I feel like that's a good lesson that we should have gotten nailed down in like third grade by the latest. But Tommie, we're reaching the end of our hour, and so I wanted to give each of you, if there's, 3 things that you think that can really help healthcare practices, human resource wise, 3 things for them to sort of, people like numbers, they like lists. Give me 3 to 5 things that can help a person as they try to reopen their healthcare practice.
Yeah, so I would start first is what's your workplace safety protocols, and what are you going to require your employees to do, and how do you communicate those expectations related to your safety protocols? That's first and foremost coming back into the work environment. And I think that applies to medical practices as much as any other business out there. The second thing is really kind of understanding what your recall procedures are in terms of bringing your employees back into the workplace, and who do you really need to have in your workplace right now? Because again, we're still faced with the virus, and we don't want to get everybody sick all at once. And so, we want to make sure that we're bringing the people in that we absolutely need to have in the workplace to get the business done. And then also rethinking what work can be done remotely. And then I think just, communications with your employees. How are you communicating with your employees? Setting up regular team calls to keep them apprised of, your expectations related to safety, answering any questions or concerns that they have. And even if you don't have the answers for them, at least you have your employees engaged and they're asking the questions about the workplace, and you can provide them with resources during those periods. So having that regular cadence of meetings with your employees, whether they be Zoom meetings or, in the lobby 6 feet apart, but, just making sure that you've got active, open lines of communication with your staff.
That's great. And Dennis, I'm going to give you the floor for a couple things. Now, this is I don't want you to talk about telemedicine or telehealth because that's next week. We are doing a webinar about telehealth next week. Let me look at my calendar. The 7th at noon. The 7th is a Thursday, May 7th at noon. You can join us again, and that email about that will be going out soon. But talk to us your little 3 to 5 things about ways that technology can be leveraged to ease everybody forward as they reopen their healthcare practices.
Yeah, I think just be on a mindful, think about the tools that you have already in existence in your office. We all have a lot of tools, but I don't think a lot of people really understand how effective those tools can be, and they seem to go out and create another mousetrap. So, every technology you bring on brings on a different sets of complexity and training to your staff, right? So, really leverage the tools that you have and you do have. I still go back to probably a little bit of security, just think about how you would help them through that. And also just the aspect of what Tommie was saying, use technology, leverage technology to bring people together. It doesn't really get rid of the social isolation aspects of it. I mean, it can help, certainly, for sure, right? I mean, a lot of time we wouldn't be having this type of conversation and doing these type of webinar if it was normal time. We would probably rent a hotel somewhere, provide some food, and have people show up, and have some alcohol or something going on and stuff like that. But yeah, I
That
think
sounds like
I
an
like
HR nightmare.
yeah.
I'm like,
But I think
this is
technology,
better.
the
This is
chat,
better for people.
yeah, the Microsoft Chat programs, right? The team, there's a lot of tools already, and you should dig into your tool of what you have that can really help you out through this time. But again, I know I'm not going to touch on too much of this, but again, it comes back down to security too, and also productivity. How can you put the right people in the right place to succeed, and also keep them communicating? And I think that's really tough, right? As an organization of our size and how many people and how spread out we are, we already have a hard time communicating during normal time, much less than in COVID-19 time, where everybody's so dispersed, and we're not touching each other, we're not seeing each other, we're trying to email the same document 10 times back and forth. How to leverage that, and also train your staff. I mean, the more time, and use this time to train your staff about the technology you have. The more training you give them, the better they are with technology, the more efficient you will be, and the more normalization you can create within your organization to continue to process business workflow effectively, right? So, and that's not just you, because it trickles down to your clients, which then your client trickles down to their client. So we're all in this together, and that's it. That's the thing, right? So, yeah. So those are some of the things I would say that would be important. Maybe, I don't know. Is it important?
No,
Maybe not.
I agree with you. I think
I
learning
agree.
these skills and getting better at something that you already do well, it's never time wasted. And I think this time, as we've had to communicate more, as someone who loves words, I'm called word girl at work. It's everyone's becoming more intentional. And I think that's going to actually serve our entire culture well.
Yeah.
That you are having to reach out. You are having to. I mean, I know that I'm not the only one who's had so many different Zoom calls with college friends or whatever that I haven't talked to in years. But now we're all saying, well, we're all isolated. Let's step outside the box. And so I think there's definitely some good things that have come out of this, and that can be applicable to do team building with your staff as well. And so we are now at the end of our hour, and I wanted to thank the both of you for coming in. No, for finding somewhere quiet in your home, or forcing the other people in your home to be quiet for an hour, bribing them, whatever way you did it. I don't know. But thank you for joining me here today. I know, as always, I learned a lot from the both of you, and I will let you know when all of this is up on all the websites, and send all the links to everyone who's interested, and you can do the same. Thanks for joining me.
Thank you. Bye.
Okay, bye.
She left.